Well, it's National Lung Cancer Awareness Month, and South Georgia Medical Center wants to remind you of how important it is to get screened. That's especially if you have been a long-time smoker.
WALB News 10's Jennifer Morejon shares with us what doctors say you need to do.
A doctor here at SGMC's Pearlman Cancer Center tells me they're now seeing an increase of patients in the community diagnosed with lung cancer since before the pandemic. With fears of hospitals during the height of COVID-19, screenings were delayed. An influx of patients now come in with symptoms and a late diagnosis in an advanced stage. Medical director at Pearlman Cancer Center Dr. Ofori says it has a higher death rate than breast cancer, prostate cancer, and colon combined. He says it's important to create awareness in the community to help diagnose sooner, treat, and prevent.
Well, the most effective way to decrease lung cancer mortality is to avoid it. The only way you can avoid lung cancer is to not to smoke tobacco. If you are around people who smoke a lot, even though you don't smoke, your risk of developing lung cancer also goes up. So you should try to avoid using it and avoid being around people who smoke.
Dr. Ofori says there's no specific symptom. It can be minor, chest pains, coughs, and shortness of breath. That's why it's hard to catch at an early stage. He says the best way to screen is using low-dose CT scans. Patients who have been smoking for years are at higher risk. Annual scans are recommended. Dr. Ofori says the survival rate of lung cancer is about 25%, but if diagnosed early, chances go up to about 60%. Some of the main treatments are surgery, chemotherapy, and immunotherapy. Jennifer Morejon, WALB, your hometown news source.